is one of my favorite patients here, and we're going to be placing an implant in the lower anterior guided. And so we are using, again, we're using the MGuide, which is a nice open guide. And you're going to see me try in the guide first, make sure that it fits. I love the fit of this guide. And the way that you know that it fits is that every part of the plastic is touching the teeth where it's supposed to be. So there is no gaps, and it is sitting perfectly onto the teeth, and it is a tooth-borne guide. I always like to flap the gums. Some doctors like to do it flapless, which means that there is no incision, and that could be a benefit to the patient. But even though the guides are almost always right on target and perfect, I still trust my eyes more than anything else. So I like to see what I'm doing, and you'll notice that in this case even, I made my pilot hole. So I did the first drill through the guide, I take off the guide, and then I look at the bone and make sure that my pilot hole is exactly where I planned it, just in case there was some error during the planning process. Then I put the guide back on, I drill a little bit deeper, and then I go ahead and take an x-ray. And now I'm confirming again that it is perfect. And so there's multiple steps throughout the process that you can do to make sure that your procedure is coming out as accurate as possible. So I take that x-ray, it looks fantastic, and so I know I can continue on to my full depth. The bone is really nice and strong here, so I'm going to the final drill, and then I'm going to place my implant right through the guide. I place the implant through the guide, and then again I take off the guide to see exactly where that implant landed. You'll see I went back with my hand instruments and lower the implant just a bit more to make sure that it's just subcrestal, which means just a little bit below the bone, and it looks nice and snug there. I put my cover screw on, and then I like to use gut sutures because they fall out in anywhere between 2 and 10 days, and the patients are very comfortable. And in this case, we also delivered a flipper, and that is so that the patient can have the missing tooth filled and can go out and be social and smile and be happy.